through it. In ophthalmology session, yes, correlation of this anatomy with the ophthalmology, that is a superior orbital fissure. When there is the any kind of the pathology within the orbit or eyeball, like the inflammation or the tumor, this structure of the superior orbital fissure may get compressed and can give the related abnormality. So this syndrome is known as superior orbital fissure syndrome. Now here we are going to prepare the notes for the various foramen in relation to the sphenoid bone from midline to the lateral side. As we have seen earlier that the king pituitary gland is situated at the midline within the Turkish saddle, sella turcica, while the queens means foramen sharum, foramen lacerum, they are located on each side of the king pituitary gland, and the king is giving rose means ROSE to the queens. So what is the foramen R? R for foramen rotundum, O for oval, S for spinosum, which is passing the E for emissary vein. So we have earlier seen this all the things. Now we are going to make the notes. So according to our trick and the mnemonic, yes, king. Who is king? Pituitary gland, which is located within the Turkish saddle, or you can say sella turcica. As we know, according to the recent pattern of the AIIMS exam, turcica means Turkish country and sella indicates the saddle word. So this sella turcica is also known as the Turkish saddle, which is located within the body of sphenoid. Now on each side of the king there is the location of the queen, who is indicating the queen word. Yes, answer is the foramen lacerum. What are the important structures passing from the foramen lacerum? We will see in another discussion. On each side of this queen there is the location of the ROSE, rose, R. Then posterolateral to this R foramen there is the foramen O, and then posterolateral to this O foramen there is the foramen S, which is passing the structure indicated by the E. So our trick is the ROSE, rose. So what are these various foramen? Foramen R is indicating the rotundum foramen, or we can say foramen rotundum. O is indicating the oval foramen, or we can say foramen oval, and this S foramen is indicating the spinosum foramen, or we can say foramen spinosum. Yes, this E word is indicating the emissary vein, which passes through the foramen spinosum. So now we are going to write down what are the important structures passing through this foramen. Yes, foramen rotundum, it passes the V2, or you can remember the maxillary nerve. Also you can say the fifth second division. Now the foramen oval, as we know, this foramen oval passes the four important structures which are remembered as the mnemonic male, and it is very important since our first year that mandibular nerve, or you can remember the V3, A for accessory meningeal artery. In short, you can remember the AMA, Amma, L for laser petrosal nerve, or you can remember the LPN in short form, and E for emissary vein. What is the emissary vein? The veins which connects the extracranial vein to the intracranial vein, they are known as the emissary vein, as we have seen in our video of the scalp. So you can remember the various structure passing through the foramen oval. They can be remembered by this first year trick MALE. So male, these structures are passing through the foramen oval. Now we are going to discuss which structures are passing through the foramen spinosum. Spinosum foramen, this foramen is passing the structures which can be remembered with the mnemonic of the MEN. Yes, M for middle meningeal artery. Now in short, this middle meningeal artery we will say the mamma. So can you remember that Amma is passing through the foramen oval, while the mamma, middle meningeal artery, is passing through the spinosum foramen, while the E for again emissary vein, there are lots of the emissary vein in our skull. So this E word here, the E word is indicating the emissary vein, while the N for nervous spinosum, this nervous spinosum is indicating the meningeal branch of mandibular nerve. Meningeal branch of the mandibular nerve which supplies the meninges, that is known as the nervous spinosum. So these are the various important structures passing through this foramen ovale as well as the foramen spinosum, while the structure passing through the foramen rotundum, that is the maxillary nerve, and later we will discuss what important structures are passing through the foramen lacerum. Now we are going to see how these nerves are passing through the cranial cavity, for which we are going to see again about the cranial cavity with the nerves. Can you see this image? In this image you can easily see that this structure is the crista galli, and on its side there is the sieve like structure, the very thin bony plate, that is the cribriform plate of ethmoid, which passes the olfactory nerve. And can you see, this is the eyeball, this is the eyeball, the optic nerve is passing through the optic canal. So this particular foramen is indicating the optic canal which is passing the optic nerve. Here is the optic nerve and this is the ophthalmic artery. So we have seen the first cranial nerve and the second cranial nerve. First cranial nerve is in close relation with the cribriform plate of ethmoid, while the second cranial nerve is passing through the optic canal. Now can you see where is the king? You can see the king pituitary gland is located here. This is the location of the pituitary gland within the Turkish saddle. And as we know that cavernous sinus, we will see the cavernous sinus later in our detailed topic, but we know that cavernous sinus is located on each side of the pituitary gland. So this is the cavernous sinus, and through our knowledge we know that cavernous sinus is having the roof, floor, lateral wall and the medial wall. Later we will see in detailed discussion, but as we know that the lateral wall is passing the third cranial nerve, fourth cranial nerve, then V1 and the V2, while the V3 is passing outside the cavernous sinus. Okay, so just apply that knowledge to this cranial cavity part when we are dissecting out this cavernous sinus on this side. So can you see what are the various cranial nerves which are passing from here? This will be the third cranial nerve, because it is the first structure which is passing through the lateral wall of the cavernous sinus. Now this is the thinnest cranial nerve, that is the fourth cranial nerve, while this is the largest cranial nerve of our body, that is the fifth cranial nerve. And this fifth cranial nerve is dividing into the three division: V1, maxillary nerve, V2, while this is the third division, that is the V3. So in this way, this fifth cranial nerve, large mass, which is known as the Gasserian ganglion, it is dividing into the V1, V2 and the V3. And as we know that whatever the foramen is near to the nerve, that particular nerve will go through that foramen. So this V1 is going, because it is the ophthalmic division, so it has to appear near the ophthalmic region, so it is going towards the superior orbital fissure part. Here the superior orbital fissure part between the laser wing and the greater wing of the sphenoid is located. So here is the location of the superior orbital fissure through the superior orbital fissure, because it is going towards the eyeball. So what are the important structure which are passing through the superior orbital fissure? Yes, this is the third cranial nerve. Next, just below the third cranial nerve, there is the thinnest cranial nerve, that is the fourth cranial nerve, trochlear. Then the largest cranial nerve, fifth cranial nerve, is the large mass which is dividing into the V1, and V1 is also, yes, it is the ophthalmic division, so it is passing through the superior orbital fissure. While now can you see the next division of the fifth cranial nerve, that is the V2, means maxillary nerve, it has to open in the infraorbital region, so it is passing through this particular foramen which is known as the rotundum foramen. Yes, foramen rotundum. How can you remember? Where we weep, हम रोते कहाँ हैं? Where we weep? Yes, we weep on the maxillary region, so you can remember the rotundum, rona foramen. Yes, ro foramen opens in the infraorbital region, maxillary nerve part. So what we have to remember, that V2 maxillary nerve passes through the foramen foramen rotundum, and opens in the infraorbital area where we secrete our tear. Okay, so now there is a third division of this trigeminal nerve, that is the V3, which is passing through the foramen ovale. Now on just lateral side to this foramen ovale, can you see this is the foramen spinosum? Yes, this is the spinosum foramen. Through this foramen spinosum, can you see the vessels are passing? These are the middle meningeal artery and the middle meningeal vein. So the foramen spinosum is passing the middle meningeal vessels, and as you know, clinical correlation, this middle meningeal vessels, middle meningeal artery, they are very important. Why? For our neurosurgery part, because they causes the extradural hemorrhage. How? Now we are going to correlate that neurosurgery part with the anatomy. See here, the middle meningeal vessels, here you can see this middle meningeal vessels, they are passing, but there is the one transparent like layer. Can you observe this transparent like layer is just below the cranial cavity? So this is indicating the dura mater layer of the meninges. So can you see this middle meningeal vessels, they are passing outside the dura mater. Observe the image. Yes, these vessels are passing outside the dura mater, and here they are opening. Okay, so in this image, this is the site, it is running very close to the squamous part of the temporal bone. So this is the middle meningeal artery. Now see correlation with the PSM and our other trauma casualty topic, that in case of the road traffic accident, this part is fractured, then which artery is affected? Which artery is in close relation with this squamous part of the temporal bone? Your answer is middle meningeal artery. The middle meningeal artery, they are in very close relation. Got the point? So what happens? This middle meningeal artery also gets ruptured, and the blood accumulates within this temporal part. So due to the accumulation of the blood vessels, due to accumulation of the blood in this temporal part, there is the collection of the mass. Because this collection of the blood is outside the dura mater, that's why this is known as the extradural or epidural hemorrhage. Okay, so this is very important. So what is the clinical case? In your neurosurgery, you will get that any patient is coming to you with the road traffic accident, gets headache, vomiting, nausea, maybe, may not be, but then the patient is presenting with the unconsciousness if there is the severity is more. In case of the X-ray, CT, MRI, if you are getting the biconvex opacity on the temporal region, so most common probability of the extradural hemorrhage is there. Why? Because now with the help of the anatomy, you are knowing that this temporal region is closely related with the middle meningeal artery. Okay, so what you will do? We have to do operation, we have to remove the clot. How you can remove? Yes, as you know, in this temporal part, there is the one H-shaped area, the H-shaped bony area where the various bones articulate: frontal bone, parietal bone, zygomatic bone, and the squamous part of the temporal bone. That part is known as the pterion. And another MCQ, that the thinnest part of this pterion is known as the Sylvian point. At this point, we do the burr opening, drilling, and then we remove the clot. This is the treatment of the extradural hemorrhage. More and the better detail you will deal in your surgery part, but you have to remember this extradural hemorrhage. That's why this middle meningeal artery is important. That's why this foramen spinosum is important. Okay, so you can draw one simple image for this extradural hemorrhage. Suppose this is the cranial cavity, and suppose this is the layer of the dura mater, and as we have seen that middle meningeal artery is located here. So this red color dot is indicating the middle meningeal artery. So if there is the fracture of this part and rupture of this middle meningeal artery, then what will happen? In case of the rupture, this artery is doing bleeding outside the dura mater, so it is lifting the dura mater layer, and blood is accumulated in such kind of the way. So can you see this blood is taking the shape because the squamous part of the temporal bone is convex outside and the durameter is also lifting inside, so the shape of the accumulated blood is biconvex lens shaped bleeding. So in case of the X-ray, CT or MRI, such kind of the blood mass is seen, then this is known as the extradural hemorrhage or epidural hemorrhage. And for the treatment, we have to make one drilling burr operation at this pterion salient point and we have to remove the clot. After the discussion of the first cranial nerve, second cranial nerve, third, fourth, fifth, which is dividing into the V1, V2, V3. Now we are going to discuss about the sixth cranial nerve. Again, as you can see this cavernous sinus image, that abducent nerve and internal carotid artery along with the sympathetic plexus, they are the direct content of the cavernous sinus. Again, this is the AIIMS question. Okay, so the abducent nerve is located within the cavernous sinus, passing through the cavernous sinus. So where is the location of the abducent nerve? When we are doing the dissection of the cavernous sinus, removing the cavernous sinus, then we can see that here is the location of sixth cranial nerve. Now this sixth cranial nerve is passing through the cavernous sinus and then it passes inside to supply the lateral rectus muscle through the superior orbital fissure part. The entire course we will discuss later, but now in the brief, that third, fourth and the sixth cranial nerve, yes, they are coming from the brain, then they are passing through the cavernous sinus, then they are running towards the superior orbital fissure, then they are supplying the extraocular muscle. So you can write down one short note. From the brain stem, the third, fourth and the sixth cranial nerves, they are emerging. Now this third, fourth, sixth, they are passing through the cavernous sinus, and after passing to the cavernous sinus, these structures are passing through the superior orbital fissure, and after passing through the superior orbital fissure, these structures are supplying all muscles of eye, yes, extraocular muscle except SO4, LR6, except the superior oblique, which is supplied by the fourth cranial nerve, trochlear nerve, while the lateral rectus muscle, which is supplied by the sixth cranial nerve. So this is the summary for the third, fourth and the sixth cranial nerve. So after this sixth cranial nerve, now we are going to discuss for the next nerve, seventh and eighth cranial nerve. Just behind to this cavernous sinus part, in between the superior margin of the petrous part of temporal bone and inferior margin of the petrous part of temporal bone, can you see this bony margin, this bony part is indicating the petrous part of temporal bone. So here there is the one foramen. Can you observe this? This foramen is internal acoustic meatus. This foramen is the internal acoustic meatus, means opening of the ear inside the skull. Outside there is the external acoustic meatus. Can you observe within this internal acoustic meatus, the cranial nerves are passing. What are the cranial nerves? Yes, this was the sixth cranial nerve. So this is the seventh cranial nerve, and here is the next nerve, that is the eighth cranial nerve. But here the other structures are visible. Can you see one small nerve which is intermediate in position? This is known as nervus intermedius, while one red color dot is also located here. This is the artery for the ear, internal ear, that is the labyrinthine artery. So we are going to draw the diagrammatic presentation of this internal acoustic meatus at this part. Suppose this is the internal acoustic meatus. So within the internal acoustic meatus, there is the location of the seventh nerve. But we have to remember that this seventh nerve is having the two parts. This thick division is the motor division of the seventh nerve, while one more division is there, that is the comparatively thinner, that is the sensory division of the seventh nerve. And we know there is the eighth cranial nerve which is having the two division, vestibular division and the cochlear division. This is the just diagrammatic presentation. We will see this internal acoustic meatus in detail in the seventh cranial nerve part, but just to remember, this is the motor division, while this structure is indicating the sensory division of which nerve? Your answer is facial nerve, while this structure is indicating the vestibular division and the cochlear division, or we can say vestibulocochlear nerve or eighth cranial nerve. Okay, this is the diagrammatic presentation of internal acoustic meatus, or we can say the internal auditory meatus. So now see the few updates from here. Yes, you can observe that this sensory division of the facial nerve is located in intermediate position between the motor division of the facial nerve and the eighth cranial nerve. That's why this sensory division is also known as nervus intermedius. This is the MCQ. Which structure is considered as nervus intermedius? Answer is sensory division of the facial nerve. This was studied by the Risberg. That's why it is also known as nerve of Risberg. So this is another MCQ. Okay, this nerve is also considered as 14th pair cranial nerve. We know that there are the 12 pair cranial nerve, but this nerve is considered as the 14th pair cranial nerve. So which nerve is considered as the 13th pair cranial nerve? Okay, you can write down 13th pair cranial nerve. This is the nervi terminalis. This is the one update. Okay, so which is the 14th pair cranial nerve? Nerve of Risberg. Which is considered as the 13th pair cranial nerve? Answer is nervi terminalis. What is the nervi terminalis? Yes, it is one nerve which is located at terminal position. Terminal position means it is very close to the first cranial nerve, olfactory nerve. Actually, this nervi terminalis is rudimentary nerve or absent in human. Yes, but very well developed in cat's dog. Yes, what is the function of this nerve? Because it is very close to the olfactory nerve. Okay, so it help in the smell. It participate in the smell function, and as we know, the smell is important for the food and sex behavior. So this is the role of the nervi terminalis, which is considered as a 13th pair cranial nerve. Update for you. One more knowledge, because this nervi terminalis is very close to the first cranial nerve, near to the first cranial nerve, that's why it is also considered as 0 pair cranial nerve. So this is one another update. So in this part you have learned which cranial nerve is considered as a 13th pair cranial nerve, which nerve is considered as the 14th pair cranial nerve, and which nerve is considered as 0 pair cranial nerve. Yes, 0 pair cranial nerve is the same 13th pair cranial nerve. Okay, so this is the structure of the foramen internal acoustic meatus with various structure passing through it. One artery is passing through this foramen, and what is the name of this artery? This artery is the labyrinthine artery which supplies to the internal ear. So after the discussion of this internal acoustic meatus, now we are going to talk for the next nerve. After this 7th and 8th cranial nerve, the next nerves are 9, 10, 11. Can you follow the same image? You can see that between the upper and the lower margin of the pectus part of temporal bone, internal acoustic meatus. Yes, this is the internal acoustic meatus. Just behind to this internal